Today we're going to be doing a treatment here for the shoulder of the rotator cuff tear. There's a small partial tear from earlier evaluation here that I'm going to be showing and demonstrating. Looking for that pathology and then delivering the treatment to the area here. So I'm going to have the patient here hold their arm next to their body and slowly externally rotate their arm and elbow, because the tear is in the subscapularis area. So I'm going to be placing the probe here and getting a good view of that area of pathology right where it is. I want to get a good spot here again. There's a subscap. So I'm coming around. And there's some of those little cortical irregularities that we could see in the bone. Right in through here. So we're gonna do some cold spray to help numb him up. Perfect. There's that cortical irregularity right there. I feel a little pinch. 1, 2, 3, and pinch. I'm gonna slowly advance the needle. Right there, we get to the rotator cuff. And there, the needle's right at that area, that focal area of the cortex, where you have that disruption. We're going to do a little bit of a fenestration. And making a little bit of contact with the cortex here. Stimulate that little bit of additional healing. You might feel a little bit of pressure here. It's a very tight space, even though we do see that change in echogenicity that we have here. I'm just going to do a little bit of fenestration again here, allow some of those cells to spread. And we'll give you a few more seconds here. Just a little bit more fenestration. And just tapping that cortex a little bit on time. And now some more of the cells are going in. Move back out. I'm going to re-angle slightly with that other area here. That way we could spread those cells out. Back down, re-annealing, and putting the cells right here, right in that spot. Yeah, that's right. We could see right that focal area of change, and putting the rest of those cells here. You're going to be done in 5, 4, 3, 2, and 1. Needles coming out. Right? Perfect. All right, so we're just going to do a little bit of to get you back into that neutral plane of motion here. We'll get you cleaned off here. So we were able to, as you can see, we are able to find a focal area, a partial tear of the subscapularis on the articular surface. So that's consistent with his symptoms and pain, and this is where we were looking in that area for the site of pathology. Easy to get to with direct communication there. I used a little bit longer needle just to make sure because of his muscular stature, and from that standpoint, but I was still able to have enough needle length there to get to that area without any problem. And so I knew she'd do very well with the treatment. So looking forward to having him follow up and let me know how he's doing. Thanks.